Hi everyone, welcome to Sonogrip. Today we will see the case of partial placenta previa, which was adherent placenta in nature and retroplacental hematoma. A 29 years old female patient who was multiple gravida came with 9 months of amenorrhea and pervaginal bleeding. Our patient was first presented at 28 week of gestation with a history of recurrent episodes of vaginal bleeding. She was closely managed and kept under observation by her gynecologist. So let's see the baseline scan first. At 28th week of gestation, it was revealed on transabdominal scanning a partial or grade 3 placenta previa with placental tissues implanted on the posterior uterine wall and partially covering the internal os. As we see, there are multiple placental legs. These are large sonolucent vascular spaces within placenta. And because of posterior location and recurrent bleeding, it was at high alert for abnormal attachment. And by applying the color Doppler, it shows multiple void of colors and retroplacental vessels appears normal. Now let's look at 35 week of gestation. The patient returned for her final ultrasound right before a planned C-section, and we see the anatomy has evolved significantly. Look closely interior to the internal os. We see an irregular retroplacental hematoma, which shows no flow on color Doppler. This hypoechic fluid collection explains her recent bleeding episodes and confirm localized placental abruption at the lower uterine segment. Now let's look at the most crucial diagnostic part, evaluating for placenta accreta. When we apply colored Doppler to the lower uterine segments, we see highly tortuous hypervascular blood vessels along the retroplacental zone pointing towards adherent placenta. However, as we evaluate the uterine wall, the underlying myometrium remains completely intact with normal distinct borders, and there is no invasion through uterine wall, which means we can rule out true placenta accreta. It is adherent but not invasive. Let's summarize all the findings what we report for this case. Placenta is present in posterior lower uterine segment, partially covering the internal os with grade 2 maturity. Placental thickness is within normal limit. Multiple large placental legs are visualized throughout placental substance. A distinct hypoechic collection is noted interior to the internal os. Color Doppler shows no internal vascularity, consistent with retroplacental hematoma. Marked vascularity with multiple tortuous blood vessels noted at the interface of posterior uterine wall and placenta, indicating adherent placenta. The retroplacental clear space and myometrial thickness appears sonographically normal and intact. And at the last for impression, partial or grade 3 posterior placenta previa at 35th weeks of gestation. Retroplacental hematoma located interior to internal os, consistent with localized placental abruption. Sonographic sign of adherent placenta without evidence of myometrial invasion. No signs of placenta accreta. Thanks for watching. Please like the video and subscribe to Sonogrip for more videos.